A 28-year-old female presents with a 6-month history of chronic diarrhea, bloating, and unintentional weight loss. She also complains of fatigue and has been found to have iron deficiency anemia on previous workups. On physical examination, she exhibits signs of mild malnutrition and has an erythematous vesicular rash over her elbows and knees. Laboratory studies reveal a positive anti-tissue transglutaminase (TTG) IgA antibody. An upper endoscopy with duodenal biopsy shows villus atrophy, crypt hyperplasia, and increased intraepithelial lymphocytes. What is the most likely diagnosis? A. Celiac disease. B. Crohn's disease. C. Irritable bowel syndrome IBS. D. Lactose intolerance. Correct answer. Explanation. 1. Clinical presentation. Celiac disease is an autoimmune-mediated enteropathy triggered by ingestion of gluten, found in wheat, barley, and rye. Patients typically present with chronic diarrhea, bloating, weight loss, and malabsorption symptoms. Extraintestinal manifestations such as iron deficiency anemia, osteoporosis, and dermatitis herpetiformis, a pruritic vesicular rash, often on elbows and knees, are common. 2. Laboratory and histological findings. At positive anti-tissue transglutaminase, TTG, IgA antibody is highly suggestive of celiac disease. Duodenal biopsy is considered the gold standard for diagnosis and typically demonstrates villus atrophy, crypt hyperplasia, and lymphocytic infiltration. 3. Differential diagnosis. Crohn's disease, option B, may present with weight loss and diarrhea, but typically has patchy inflammation, transmural involvement, and can affect any portion of the gastrointestinal tract, features that differ from the continuous gluten-induced enteropathy seen in celiac disease. Irritable bowel syndrome, IBS, option C, is a functional disorder without the malabsorption, positive serologic markers, or biopsy abnormalities seen in celiac disease. Lactose intolerance, option D, generally causes bloating and diarrhea after dairy ingestion, but it does not lead to the systemic signs, e.g., anemia, dermatitis herpetiformis, or the histological changes found in celiac disease. Key takeaways for Puerto Rico medical exam. Celiac disease is an immune-mediated reaction to gluten, presenting with malabsorption symptoms, iron deficiency anemia, and may include dermatitis herpetiformis. Serologic markers, such as anti-TTG IgA, are crucial in the workup. Duodenal biopsy, showing villus atrophy, crypt hyperplasia, and lymphocytic infiltration, confirms the diagnosis. Management involves a strict, lifelong gluten-free diet, which is the mainstay of treatment. Would you like a follow-up question on celiac disease management or related